recent events in Afghanistan have really taken a toll on veterans active duty and their families. Retired Army Lieutenant Colonel and Afghan combat veteran Damian McCabe is here to tell us how they can seek help. You are in charge of behavioral health, military affairs at UCHealth. What is it that they're facing? Because you know this so well as a combat veteran.
Well, thanks, Diane. I appreciate the opportunity to speak with you guys tonight. For us in the last 3 or 4 weeks, what has really picked up is conversations and contact around veterans expressing frustration, anger, some sense of hopelessness. But some of that is really fueled by how they receive the information. Mm-hmm. And as you guys know, the concern I had around the narrative of it was that this was a narrative of failure. The people I serve with, the veterans that I work with, that's a terribly impacting statement. And when we start thinking about suicide prevention, the last thing we want to tell people already struggling with this idea of failure is that what they did didn't matter. And it absolutely did matter. And so our effort recently is about talking with them and having them talk with each other about what mattered. What did they do? Who did they work with? What changes did they bring? And even if those changes are not durable, mm-hmm. if they don't last, for that period of time, they did their service. They got their missions, they completed their missions, they changed the lives of people. And they fought alongside each other day in and day out, and for the most part, came home safe. For a number of folks being told that that doesn't matter, that that's a failure, it really changes that frustration and anger to things like depression, mm-hmm. Or anxiety.
And you will help them with that. So how do you want them to contact you?
So within our system at UCHealth, we have behavioral health providers in all of our primary care clinics. Any person could go into their primary care doc or doctor and just basically say, I'm not doing well. Mm-hmm. Can you refer me? Can you get me hooked up? And we have providers, really gateway agents, to help people get into our service. UCHealth is standing up an intensive outpatient program for behavioral health that's targeted just at veterans and military personnel. And that will begin next week, taking patients in there next week. Timing is everything, and this was not part of our plan, mm-hmm. but we're going to scale that up quickly to be able to receive as many folks as we can.
We're so glad you're doing it. We're so thankful. They need your support. You know what it's like. So thank you so much.
Thank you. I appreciate the opportunity.
You're welcome.